Rural and small urban transit agencies provide a vital service to their users, connecting them to healthcare, education, employment, shopping, social activities, and other important activities. As transit systems compete for funding at local, state, and federal levels, it's important to identify and quantify, where possible, the benefits and impacts that these services have within local communities. Transit agencies need data regarding the benefits of investments in transit to inform investment decisions. The objective of this research, which was sponsored by the Minnesota Department of Transportation, was to document and measure the benefits and impacts of rural and small urban transit services in greater Minnesota. We identified two main types of societal benefits from transit, which we called mobility benefits and efficiency benefits. Mobility benefits are benefits from providing transportation to people who otherwise would not have been able to make those trips. These include healthcare benefits from providing transportation to healthcare services for people who would not have made those trips, the benefits from improving access to jobs for people who otherwise would not be able to get to work, and the benefits of improving access to other activities. Efficiency benefits are benefits from people making trips by transit instead of driving, getting a ride from someone, walking, or making that trip some other way. These can include cost savings as well as time savings for family members or friends who otherwise would have had to provide the ride. In addition to the societal benefits of transit, there's other economic impacts of transit, which we estimated separately through an economic impact analysis. These include economic impacts from transit spending, from improved access to shopping, and from keeping people living in the community. After we developed a method for measuring these benefits and impacts, we selected 6 transit agencies in greater Minnesota as case studies. The case studies included Paul Bunyan Transit, Southern Minnesota Area Rural Transit, or SMART, St. Cloud Metrobus, St. Peter Transit, Timber Trails, and Trailblazer Transit. For each of these case studies, we surveyed transit riders, and we used the survey data in estimating the benefits and the impacts of these services. Results from the survey showed us that transit in greater Minnesota serves many riders with limited transportation options. Many of the riders did not have a driver's license or access to a vehicle. Many were low income or had a disability, and transit also serves a higher percentage of older adults and minorities. About 1/3 of the riders that we surveyed said that they would not have been able to make their current trip if the transit service was not available. Most of the rest would have gotten a ride from someone, used a taxi or Uber if available, or walked. Very few would have driven themselves. For all 6 agencies that we studied, the estimated benefits were found to exceed the cost of providing the service. Benefit to cost ratios were found to range from 1.5 to 4.2, indicating that the benefits of transit ranged from $1.50 to $4.20 for every $1 that was spent on transit. A substantial share of the benefits come from providing access to healthcare services for those who otherwise would not have been able to make those trips. This results in reduced healthcare costs and improved quality of life. Other significant benefits come from improving access to employment, which has the benefit of reducing public assistance spending for people who would not be able to maintain employment if not for transit. In fact, many riders said that they would not be able to keep their job without transit. Another significant benefit is the vehicle operating cost savings and time savings for people such as family members or friends who would have had to provide the transit user a ride if transit was not available. And we refer to those as the chauffeuring cost savings. Many other intangible benefits were also identified but were not quantified in monetary terms. Most riders agree that transit increases their social interaction with other people, it reduces their stress level, it allows them to live independently, and it keeps them connected to their town. And it also improves their overall quality of life. And transit was also shown to promote equity. The economic impact analysis also showed that government spending on transit directly and indirectly supports many jobs in greater Minnesota. Local businesses also benefit from improved access to shopping and from keeping people living in the community. The research provides information to objectively assess the benefits of public spending on transit services in greater Minnesota, which can be used to support investment decisions. Results are also likely to be useful for other rural and small urban agencies across the country. For more information about this research, you can visit our website or contact me. My name is Jeremy Matson. I'm an assistant professor at North Dakota State University, and I work for the Small Urban and Rural Center on Mobility, or CIRCOM, which is a program of the Upper Great Plains Transportation Institute at North Dakota State University. At CIRCOM, we provide research and education for improving mobility in rural and small urban communities. Visit our website for more information about this research or other research projects, as well as our education programs and training opportunities.